There's been a concerning rise in the number of RSV cases among kids recently. The Minnesota Medical Association wants parents to be on alert ahead of the holidays. Earlier today, they shared what you can do to keep your kids healthy.
As you know, for the past several weeks, we've been seeing a dramatic increase in hospitalizations of young children with RSV. Now, RSV is not a new illness, as everyone knows. We see it usually in mid-December through March, sometimes extending into the spring. But what's unusual in the current situation is both the timing, much earlier than usual, starting in late September, October, into now is early, and this is also a more severe season than we've seen in the past several years. RSV, as everyone knows, characterized by nasal congestion, nasal drainage, cough, often some fever in young children. In the younger children, it can often interfere with their ability to bottle or breastfeed, and it can lead to problems with dehydration. As a result, our pediatric ICUs at Children's have been operating at capacity, actually over capacity for the past several weeks. There have been days when we've had 30 to 40 children waiting in our emergency departments, waiting for an inpatient bed. That's unprecedented. That backs up the care for all the other children. And on top of this, as if the RSV surge wasn't enough, we've had an unprecedentedly early start to the influenza season. And just last week, it appears as if influenza A cases are beginning to outpace RSV. So while wait times in our emergency departments, all EDs actually, which you'll probably hear here, have increased, I think one important point to emphasize is that for parents coming to a very crowded emergency department, you may get there and say, oh my, look at all these patients here. We don't want that to happen. I want to assure people that if your child is very sick, is very ill, extremely injured, we have a triage system which identifies the most critically ill and injured, and your child will be seen promptly. So I don't want to discourage anyone from coming and seeking care, but do know that the wait times for the less critically ill are a little bit longer than usual. It can be frustrating for families, but in the meantime, take steps to protect yourself, get a flu shot, stay home if you're ill, keep your child home if you're ill, practice self-care, get a lot of sleep, a lot of exercise, and a lot of rest. And hopefully we'll all get through this together.
Being part of Greater Minnesota adds additional challenges during this time. So being a parent in Greater Minnesota means that if you have a child who suddenly has difficulty breathing, you seek care in the local emergency room. And you find out in that emergency room that your child has low oxygen. But now you learn that access to inpatient hospital care in Greater Minnesota is limited. And so you realize that your child can't stay in your local community in which you live, and they need to go somewhere else for their care. But that somewhere else could be 4 to 5 hours away. Now you're a provider taking care of that patient in a rural setting in Minnesota, and you realize that that child needs care, and so you call around to every hospital system in the state of Minnesota asking for someone to take this child into their hospital settings. And you find one bed, and that's 5 hours away, and now you are with you as the provider and the parent with their child are now forced to take that 5-hour either ambulance ride or helicopter ride to that nearest hospital bed. Or in some settings for us, it means that there are no beds at all available, and that child needs to sit in the emergency department at their local facility for days until a different bed can become available in this state. These are just the realities that we're facing right now in Greater Minnesota.
So why are we at this situation? Well, we have RSV, influenza, COVID at the same time, mostly influenza and a lot of RSV. RSV affects those who are less than 2 years old the most, but we also have all the other viruses. I've been seeing rhino and enterovirus. I've been seeing parainfluenza viruses. These viruses do not need a name. They are a virus. Kids who are vaccinated are very well protected. So if your child is having a fever over 100.4 for 5 days in a row, we definitely want to see them in the emergency department. If your child is struggling to breathe, their nostrils are flaring out and in, kind of like that bull that you see on the cartoons back in the day of Looney Tunes. If your child is pulling in under their ribs or between their ribs, suction their nose if they have RSV or cold and their nose is snotty. And then if that's still going on, you need to come in to see us. If they're not making very good wet diapers and they're really struggling to finish their feeds, bring them in to see us. Call your pediatrician first. See if they can offer some support. If your pediatrician says you need to go in, you need to come in. If your child has an underlying respiratory illness like asthma or an underlying immunodeficiency, an underlying cardiac condition, they're likely going to need to seek care in the emergency department. And lastly, if they have like pale blue colored gray ashen skin, they definitely need to be coming into us right away. We want to help everyone out. We want to have space to help everyone out. And please have mercy on us. We are working very hard and doing our absolute best. We are parents just like you. We are Minnesotans just like you. And we want to take care of you.
First, I think I speak for all of us. We'd like to apologize for what the RSV, influenza, COVID pandemic how it's impacted all our communities. It is not the way we like to deliver care, to walk into our ERs and see the number of boarders that we have, to see the long wait times, to try and get patients up to an ICU or an inpatient bed. This is not what we had predicted or would like to happen. And so one of the things we've learned from the pandemic, one of the silver linings, is we have figured out ways to deliver this care that's not necessarily in an ER or in a clinic. We have developed and really improved our ability to do much of this care virtually. So I would encourage all of our patients and families who are feeling anxious, understandably anxious about their child, think about, if they're not really ill, if they're not turning blue, as Dr. Strobel mentioned, not significantly sick, if it's just a question, is it a fever of a day or two or three okay? Call your triage systems and your health systems. Think about an e-visit. Think about a virtual visit. Think about virtual urgent care.
We are privileged to live in a state that has top-notch health care for both children and adults. And the fact is that this partnership that we are talking about today between health systems, to give you a common message, extends as well to our families. We want to partner with you guys that have children that may be sick. We want to partner with daycares and school systems to help us get through this respiratory surge. There's been a lot in the press already, especially the national press, about what a tough season it is. And the truth is, we all realize that, right? We're living it day to day when you hear how many kids are calling out sick from your, with flu, and your daycare has the notice on the door. But with knowledge comes power. And I think that's why we are all here today, to help give you the knowledge that you can make good decisions, especially going into a holiday weekend here. We need to know what's safe to share at Thanksgiving, and it's not always mashed potatoes and gravy. Sometimes it is, the sneezes and coughs that we have to think about too.
We can prevent respiratory illness, and 2, we can prevent burnout of healthcare providers and healthcare workers. But we need your help. We need you guys to join our team. Right now, there's a lot you can do to stay healthy. We want you to stay healthy, and we want to help. And the opportunities right now are for people to go in and get their COVID shot, to go in and get their flu shot, to wash their hands, to wear a mask, to stay home if they're sick, keep their kids home if they're sick. And if their neighbors got kids, help them out, because it's tough to keep your kid home when they're sick, or to stay home when you're sick and you got a million other things to do. Together, we can prevent a lot of this illness by working as a team and doing the stuff that we all know is effective. The other thing is that this has gone on a long time, and healthcare workers are tired. Number one, help us, by staying healthy. But number 2, be kind to healthcare workers. We show up every day to make sure that you get great care no matter what happens. And a thank you, a kind word here and there makes an absolutely huge difference.
Keep watching CBS News Minnesota for continuing coverage.